Knock, knock. Can I close this for patient privacy? Hi, my name is McKenzie, and I'm going to be your student nurse for today. And we're going to be doing a physical shift assessment. So I'm going to be assessing you from head to toe, okay? Is it okay if I move this? No. Thank you. Okay. All right, so can you identify for me your name as well as your date of birth? Okay, Marvin Stewart, 5/6/1955. Let me just go check in with the EMR, okay? Marvin Stewart, 5/6/1955. Great, thank you. And can you tell me on a scale of 0 to 10, 0 being no pain and 10 being the worst pain of your life, where you're at right now? 0? Great, okay. And do you have any other allergies besides ciprofloxacin? Okay. Thank you. All right, so I'm just going to raise this for a working height. So I'm just going to be asking you a few questions to identify your level of consciousness. So can you tell me where you are right now? And can you tell me why you're here? Great, and then what's the date? Yes, that's correct, and then you already identified your name for me. Okay, so I'm just going to start by inspecting your face, okay? So I'm just going to be looking. Can I move your jaw this way a little bit? Thank you. Okay, I'm going to be looking at your face. Good, and I'm going to be shining this light to your mouth, okay? So can you just say off for me? Good. Stick out that tongue. Thank you. I'm just going to be looking up your nasal mucosa. Great. Now I'm going to be looking into your eyes, okay? So if you can just look straight forward. I'm going to be doing it 2 times per eye, okay? All right. 1, 2, looking at the other eye. Now into your left eye, okay? Ready? 1, and 2. Great, thank you. Now I'm just going to be inspecting your ears, okay? Looking for any drainage or anything. Great, looking behind the ears for any pressure sores. Now I'm going to come to the other side, okay? Looking in this ear. Good, looking behind the ear. Great, and can you just lift up your head for me so I can look behind and see if you have any pressure sores? Great, so I don't see any pressure sores, which is good. All right, so now I'm just going to be inspecting your neck. Is it okay if I pull your gown down to your waist? Thank you. All right, so the neck looks good. Now I'm just going to be pinching your chest. This is to see if you're dehydrated. It's called a skin turgor test, but it's not going to hurt, okay? All right, that looks great. Okay, so now I'm going to be listening to your lung sounds. So if you can just take a deep breath every time I touch my stethoscope on your skin, that would be great, okay? But before I do that, I'm just going to sanitize it really quick with an alcohol wipe. So again, just take a deep breath for me every time I touch the stethoscope to your skin, okay? All right. Great, thank you. Okay, so now I'm just going to be listening to your apical heart rate, which is right below your left nipple. You can breathe normally during this part, okay? And it's going to be for 1 minute, all right? Okay, great, thank you. All right, so now I'm gonna, if you can just roll over, and I'm gonna be listening to the lung sounds on your back, okay? So again, every time that I touch the stethoscope to your skin, just take a deep breath, okay? So you can just roll over. Okay, so remember to take that deep breath, okay? Great, okay. So while you're here, I'm just gonna inspect the back of your head, behind your ears, as well as your coccyx to see if you have any pressure sores, okay? All right, thank you. Everything looks good. You can roll back over, okay? All right, I'm just gonna pull this up again. All right, so next I'm gonna be looking at your abdomen, okay? So I'm gonna pull up your gown from here. All right, so based off inspection, I can see a surgical lesion. You have a little bit of redness and a cut to the left of your surgical lesion. Can you talk to me about your appetite? Have you noticed an increase, a decrease in appetite, or has it been about the same? Okay, and have you been experiencing any nausea? Okay, great. And can you tell me when your last bowel movement was? Uh-huh. And what was the consistency and color like? Okay. And also, the last time you urinated, what was the color? Okay, great, thank you. So I'm just gonna start by listening to your stomach, okay? I'm gonna be working on 4 different areas. So you could, again, you can just breathe normally during this part.
All right, I'll be back.
Great, now I'm just gonna be lightly palpating your abdomen. If you experience any pain while I do this, please let me know, okay? Okay, no pain with that? All right, great, thank you. All right, so next I'm gonna be looking at your upper extremities, just inspecting to see if you see any scars or lesions, any bruises or bleeding. Okay, great, everything looks good. Okay, so next I'm just gonna be pushing down to check for edema, which is kind of like swelling, okay? Okay, and on this side. Great, thank you. And then if you can just put your arms out like this, I'm gonna be taking your radial pulse. Great, thank you. And then while we're here, can you just squeeze my fingers? Great, thank you. Now I'm going to be pushing against your thumbnails, okay? This is a check for capillary refill or blood perfusion. Great, thank you. And can you put your arms like this for me? Great, thank you. And can you push against me? Good, push, push. And then now pull towards your own body. Pull. Great, thank you. You can relax your arms now. Okay, next I'm going to be looking at your lower extremities. So is it okay if I pull the blanket up to your knees? Okay, great, thank you. All right, so I'm going to pull you up a little bit so you can straighten your legs. All right, great. So I'm just going to be inspecting your legs. Just looking for any bruising here. That's good. Okay, so now I'm going to be pushing again like I did with your upper extremities, okay? Looking for any edema. Okay, everything looks good. Now I'm going to be taking your posterior tibialis pulse, which is right here. And then I'm going to be checking your dorsalis pedis. Okay, great. Again, I'm going to be pushing down against your toenails to check for that capillary refill, okay? Thank you. So while we're here, can you push against my hands like you're pushing a gas pedal? Thank you. And now can you flex your feet towards you? Great, thank you. And can you put your feet in like this? Good. Can you put them outward like that? Great. So while we're here, I'm just going to be checking under your ankles for any pressure sores. Don't see any on that side. That side looks good. Great, thank you. And then now, if I can just have you bend your knees. Great, and can I have you resist me and try to kick the ceiling? Good, and now can you bring your knees in towards you? Resist me. Very good, thank you. You can go ahead and relax your legs. All right, Mr. Stewart, so this concludes my assessment. Do you have any questions for me or any concerns? Okay, great, thank you. And I'm just going to go ahead and put this next to you, okay, so it's within reach. And all your genitals are up. And then your call in is going to be right here, so if you need me or you have any more questions, you can just go ahead and click this, okay? All right, great, thank you. So this concludes my assessment. All right, so for verbal findings, Mr. Stewart was able to identify his name as well as his date of birth, and it matched up with the armband as well as the EMR. He was able to identify LOC ×4. He knew who he was, where he was, what the situation was, and what the date was. His pain was 0 out of 10, but if he did report pain, then I would go through the old cart mnemonic, which is O, onset, so when did it start, L, location, where is it located, D, duration, how long has it been, C, characteristics, does it hurt, does it burn, does it sting, A, associated manifestations, does anything go along with it, R, does it radiate at all, are there any relieving factors, and T, what have you done to treat it, have you been given medicine for it, or anything like that, applied a heat pack to it. I inspected his face, and his skin color is normal for ethnicity. I looked at inside his mouth, and his oral mucosa is pink. He doesn't have any bleeding, canker sores, irritated gums. I looked up his nasal cavities, and he didn't have excess mucus, and they were pink as well. And then I looked into his eyes, and his sclera is white, and he did have consensual eye restriction and perla. And then when I looked at his ears, he had limited cerumen, and everything looked great. And then I looked behind his ears and behind his head for any pressure sores, and there wasn't any sign of any. And then I inspected his neck, and everything looked good. He didn't have any lesions or anything. And I also did a skin turgor test on his chest, and there wasn't any tenting. And then moving to his lung sounds, I checked his anterior and posterior lung sounds, 8 points each, and everything sounded clear and resonant. There weren't any adventitious sounds like stridor or wheezing. And I also checked his apical heart rate, and I checked for 1 minute, and it was 72 beats per minute, which is within the 60 to 100 normal range. And then I also, when I was looking at his posterior lung sounds, I looked, and his coccyx didn't have any signs of pressure sores. Moving on to his abdomen, he didn't report any nausea. His appetite that he said was normal. His last bowel movement was last night, and the color was brown, and the consistency was soft, and the color of his urine was a light yellow. And so when I looked at his skin, he did have 6 staples in the midline for a lesion, and that was from his surgery. And then he also had mild redness and a cut next to it on the left side. And then I also listened to all 4 quadrants, and it was normal active in all 4 quadrants. And when I lightly palpated, he did not report any pain. I didn't feel any masses, and he also didn't have any facial grimacing when I was doing that. And then upon checking his upper extremities, everything looked normal for inspection. I didn't see any bruising or bleeding or any cuts. And I checked for edema on both arms, and there wasn't any edema bilaterally. His radial pulses were 2+ bilaterally. His capillary refill was less than 3 seconds bilaterally, and he was able to grasp both my hands. And for his elbow test, he was 5 out of 5 for strength and flexibility. He was able to bring his arms up. And then for his lower extremities, I checked for edema, and there was no edema bilaterally. I also inspected his legs, and there weren't any cuts or bleeding or bruising or anything. I checked for his posterior tibialis as well as his dorsalis pedis, and both pulses bilaterally were 2+. I checked for capillary reflow bilaterally, and it was less than 3 seconds. And then I also checked the back of his heels for any pressure sores, and there wasn't anything. He had good flexibility in his ankles. He was able to move this way and outward, and he was able to push down against me like gas pedals and flex up towards his own body. He was also able to bend his knees, which shows 5 out of 5 strength, and he had good flexibility. And then I also checked again, like I said, the back of his heels, and he didn't have any pressure sores, and he didn't have any like skin abnormalities from any O2 lines or IV lines. So everything looked great. And this concludes my physical assessment.